Welcome everyone to the Medicare Team podcast. Coming back here today. My name's Joshua, joined with Sean. We're both licensed agents, have been helping Medicare beneficiaries out all over the country. So today we're going to be going over some common Medicare mistakes that we've seen people make. So I'll let Sean go into his first story he wants to talk about today.
Yeah, absolutely. So, I think when you're dealing with insurance and Medicare, obviously there's going to be a ton of mistakes that people make. It's very common. I think one of the big things for me that I see a lot with some of the people we talk to is not checking up on their benefits each year.
Mm-hmm.
Around October, December time, it's AEP, that's the annual enrollment period, which allows anybody to make a change to their insurance. So, a lot of times talk to people that are very stuck in their way and just want to stay with the same plan that they've had for years and years and years without kind of being open to taking a look at potentially new plans that may have, more benefits for them, may cover them in better
Mm-hmm.
ways, things like that. And, sometimes it just comes down to, it's something that you've been with for a while. It's always taken care of you. You're not really concerned. You feel like you don't need to change it. But in that time period, there are a lot of new plans that come out. There are a lot of change to current benefits and things like that. So I do think it's important for people to take that annual look and try to
Yeah,
find
for
something.
sure. That's very important. And I kind of like to relate it back to like electric companies. A lot of
Hmm.
times they'll get you with them lower power bills just to get you signed up with them. And then overnight, like when you're not looking, they're gonna jack those
Check that
rates
up.
up.
Yep.
So it's important every year because every year these companies are able to change everything about their plans
Hmm.
overnight. So it's important to do yearly review just to make sure that everything's still lining up and looking good for you for the upcoming year.
Yeah. And even to touch on that more, like, each year certain doctors can become,
Mm-hmm.
out of network, which just means that they don't accept that insurance carrier anymore. And so it is really important to do that annual check and just make sure that everything's still lined up, the medications are covered, your needs are met with the plan, and just that it is still a good plan for you at that time.
Yeah, and we at the here at the Medicare team, we're here to help you. That's what we do every day. So if you need an annual checkup or anything, feel free. Wherever you're watching, whether that be the description, there should be something down below. You can schedule, book an appointment with a licensed advisor, and we're here to help you out in your Medicare journey. So I have another story, a mistake. This one's a bit funny. So it's sad, but it's kind of funny looking back on it. So this person called in to one of my associates who I work with, and what ended up happening is they needed to go get their dentures done. So they got their teeth pulled. So just for reference, this is before they started working with us. It wasn't us
Hmm.
who did this, but they got in, they got their teeth pulled. And then the dentist said, like, hey, you got no coverage for dentures at all. You're going to have to cough up $1,000 or else you're not getting any teeth. Cause I was like, I'm just trying to think, like, if you didn't have it, if that person didn't have $1,000, they're going out with
Yeah.
with
There's
no
nothing they
teeth.
can
It
do.
would have been bad. So it's important really to think about the year upcoming and seeing how you're going to use your medical benefits. Are you going to be
Exactly.
going to the dentist? Are you going to be going to get a new pair of glasses, some
Hmm.
hearing aids? Because that can really affect what plan you're going to want to join for your Medicare Advantage.
Exactly.
Mm-hmm.
And that kind of touches back on the annual checkup of, say the next 2 years, that you don't need any dental. That's fine. You can find a plan that maybe, sacrifices some dental to maybe give you
Mm-hmm.
some extra money, things like that. But then, say for this year, you do need dental, then it is important that you do that annual checkup and try to find a plan that covers your dental or your dentures, crowns,
Mm-hmm.
whatever it may be in a more effective way. So it is
Yeah.
very important.
And we're talking more on the Part C, so the Medicare Advantage side of things. If you're on a Medicare Supplement or a prescription drug plan, if you're healthy, a lot of times you can switch around to try to get a lower rate as well. A lot of people don't know that. Although, if you're not like in your initial enrollment period, you're not going to have that guaranteed issue right, which means you would have to go get a health check. But there's no harm, no foul in trying to see if you can't get a better rate for yourself for sure at the same time. So yeah, do you want to go into the next story, Sean?
Yeah. I think another mistake, again, it kind of touches into that not making, not to do that annual checkup. around that annual enrollment period, again, it's that around the October to December time, we talk to a lot of people that are somewhat hesitant to change their insurance. And it kind of goes roughly like, yeah, well, I've been with this carrier for so long.
Mhm.
It fits all my needs. And I'm just kind of scared to make a switch and be stuck in that plan. I think if, that's kind of where your needs lie. I think
Yeah.
especially in that annual enrollment period, you don't really have to worry about being stuck in that plan because then after that, you have that January to March time where it's the open enrollment, which still allows you to make a
Yeah.
once change, which is nice because then you can try a new plan from AEP. Try it for January, February, see how it is. And if it's not something that, fits your needs, then you do have that one time change to go back to where you were.
Yeah, it's a lesser known enrollment period. It's not legally allowed to be advertised, which is why you don't hear about it. But it is there. I call it like the whoopsie enrollment period. If
Hmm.
someone makes a whoopsie, you're able to get out of a bad situation
Hmm.
when it comes to your plan. So definitely taking a look every year is definitely something that can be very helpful for you. Big mistake we see a lot of people make is when they're turning 65, they don't either get their Part D, which Part D is for drugs. They don't get their prescription drug coverage right then. Um, and you're going to be asking, Joshua, I don't take any drugs right now. Why the heck would I want to make sure I get this coverage?
Hmm.
Well, the reason why is the government set up a system where you're going to have what they call a late enrollment penalty. So after you turn 65, every single month that you're not currently having medication coverage in the future when you would want to join a plan that does cover your medications, so let's say you have some type of health issue or as you age, naturally a lot of people start taking
Hmm.
medications. It's going to become very costly because they have an additional permanent penalty. So it's not an immediate cost you'll see as you're wanting to join one of these plans in the future. I mean, we've seen it. It's actually not super uncommon for people to do,
Yeah, seen it
unless,
quite a lot.
yeah, unless you have some type of qualified coverage, such as you're in the VA or have like military coverage where you're able to avoid that penalty. It's very, very important that you sign up for your prescription coverage when you turn 65 so that later you're not paying the cost for not doing that.
Mhm.
And the same thing applies for your Part B premium as well. So they do that one, I believe, on a yearly basis. So every year, you're going to be paying more if you don't have your Part B activated.
Mhm.
So if you're like, I don't need that medical coverage, I don't want to pay the premium for my Part B, which I believe is around 202 this year.
Yep.
I was 185 last year. If you're like, I'd want to save that money. You're just going to have to know that when you rejoin, you're going to be paying a lot more than everyone else.
Yeah.
So it's very important that you avoid that late enrollment penalty, um, which just simply is as soon as you turn 65, just make sure that
Signing
you
up.
have coverage
Mhm.
with your medications and your healthcare that's qualified or you have through Medicare. So it either needs to be qualified coverage, which if you let's say you have an employer insurance,
Mhm.
or through the VA, they'll tell you if it's qualified insurance. But yet again, please call in. We're here to help you as well. I know this
Yeah,
can all be quite
absolutely.
confusing. So that's another mistake that a lot of people make is with their late enrollment penalties.
Yeah,
Mhm.
and funny enough, like you said, it is not uncommon. I see it quite a lot.
Mm.
Just someone I talked to last week had actually they went 120 months without Part
Oh,
D,
wow.
which, you go that long, you're gonna have, quite a big late enrollment
Yeah.
penalty, so I understand, wanting to save money and feeling that, if you're healthy, maybe you don't need it. But I think it is important to just get the coverage as soon as you become eligible. That way you don't have to worry about any late enrollment penalty or anything like that in the future.
Yeah. And then another mistake I see people make is just not considering other options. A lot of
Mhm.
times, supplement and advantage, it's like this big wall and divide. Like people who are on one side, who are on advantage plans, are diehard advantage plans people.
Mm.
People who are on supplements are diehard supplement plans. But the truth is it varies based off of each person. There's lots of advantages and disadvantages to each one. So being able to really be open just to be educated, because I think a lot of the fear that people have in these types of plans is just the fear of the unknown. So you're afraid of what you don't know. So being able to educate yourself on what you do know, being able to educate yourself so you do know, so you can make an educated, informed decision without fear. So that's another big mistake I see a lot of people make.
And like Josh said, I think that is a big thing of just the fear of unknown, basically. Like,
Mm-hmm.
I've had this carrier for so long, nothing's ever went wrong. I'm scared to switch and potentially have plenty, a plethora of
Yeah.
issues. But I think it is important, especially like if you call in to us, we're just going to give you all the information that you need regarding the plan. And yeah, even if it's a situation of maybe you don't want to switch, maybe you just want to see what's out there. That's
Yeah.
basically our job to just let you know of, what comes with this plan, what's the coverage like, what are the benefits like, and things like that. So as long as, you're open to learning and, willing
Yeah.
to hear about the plan, then I think that's the most important thing as well.
Yeah, and it's the best when both parties are here. We're just to learn, just give information. There's
Hmm.
no pressure. You will do what you think is best for yourself.
Mm.
We're just going to we always do what's in your best interest. So if
Yep.
you're in the option that we see best fits your needs, currently we're going to tell you like, "Hey, I would recommend you don't switch. You look like you're in a very suitable option for yourself right now." But, there's lots of experiences we've had, a lot of experience and people we've helped in the past, where we might have like an eye or be able to see something that
Hmm.
someone who isn't in this field day or night would be able to see. And the good news is it's not costing you anything. Like our services are completely free. It's not going to cost you any benefits. You're not going to be paying more by using us or not using us. So I
Hmm.
mean, there's literally no
A real downside
no
to just
downside to
calling in
calling
and at
in and
least
just
just,
seeing what's
yeah,
here.
seeing what's available. And funny enough, touching on that, I actually had an individual later or earlier this week. He called and he was on a Medicare supplement plan, like you
Mhm.
said, and he had full Medicaid. So
Oh.
initially, I'm looking at some plans that would offer him a lot of money each month, help him out. And he let me know, yeah, me and my wife, we had a Medicare Advantage plan in the past. It just didn't really fit their needs. And so that's
Mhm.
why they went to the supplement plan. And that's pretty much just where our conversation ended. I'm not trying to push him to join the Medicare Advantage plan. I let him know of how that Medicare Advantage plan could potentially help him. It seemed like he was very happy with the supplement, and that was it. Let him go, and if
Yeah.
he's happy with the supplement, then that's makes me happy as well.
You said he was full
He
Medicaid.
was full Medicaid, yeah.
So, I know this might be a little bit in depth, so I'm gonna take this very slow here.
Hmm.
So if you qualify for, partial Medicaid, which is more like your QI, SLMB, those things are gonna pay for your monthly Part B premium.
That 202 you were talking
Yeah,
about.
and
Hmm.
when you get access to that or beyond, which is like your full Medicaid, so QMB plus, anything that has like a plus at the end of
Hmm.
it, SLMB plus, those are all lots of acronyms. I'm sure your advocate who gets you that will just tell you it's partial or full. So full pays for all your medical expenses. So it's almost like a supplement, but you're not paying for it. The government is the one that's paying for it. So if you are on full Medicaid, there's literally no reason that you should stay on a supplement plan because of that reason that the government's paying for everything. Also, a lot of people don't know this. You actually get guaranteed issue to go back into a supplement plan if you lose your Medicaid status. So there's not really a downside. If you do leave your supplement, you can still get right back into it if you lose your Medicaid. So that is a way people are able to get back in. So
Yeah, that's really
yeah.
nice. And yeah, and that it just helps like kind of eliminate the fear.
Mm.
Is this going to affect me? Am I going to go to the hospital and not be able to pay these hospital bills? And like you said, with full Medicaid, it is going to take over a lot of that cost sharing. So very good.
Yeah, for sure. Another big mistake I see a lot of people making is not checking to see if they either qualify for Medicaid or if they don't qualify for their state like pharmaceutical assistance program. Like
Mm,
a lot of times your state will have programs to help you pay for your medications. I've seen people that making $800 less a month that did not sign up. They could have had full benefits. All they had to do was just sign up, do a little research,
wow.
would have gotten hundreds of dollars on a food allowance, had all their medical bills paid for. He actually had medical bills and medical debt.
Oh, wow.
That would have been like if he would have just known about it and
Hmm.
signed up, like he could have avoided all of that. So that's a very big mistake I see a lot of people make. There's no harm, no foul to signing up for these government programs. They're here to help you. And also, just so yeah, sorry, I'm going into the weeds a little bit here. If your income is just slightly above the limit, I've seen a lot of people actually qualify if you have a lot of medical expenses, you can
Mm,
count those medical expenses against your income to qualify, for Medicaid. But I would talk to your local, like, your the Medicaid office and see if there's anything they can do. They're more experienced in that area, but just if you're lower income, there's literally just a couple seconds of research. You'll be able to see what the income status is for couples and singles in your
mhm,
state. You can just do simple Google search. It'll tell you. And if you get access to Medicaid and government assistance, you can get access to a lot more benefits, a lot higher benefits
mhm.
when it comes to your Medicare Advantage plans as well.
Definitely.
Yeah.
Yeah, definitely with having that full level of Medicaid, you can definitely get a lot on that, especially that food card allowance that,
Mm-hmm.
you see all the time. Yeah, full Medicaid definitely helps with that. The other common mistake that I want to touch on was I talked to a lot of individuals where the husband and wife are on the exact same plan, which I think sometimes makes sense, but I think sometimes it doesn't. I've talked to individuals where maybe the husband doesn't take many medications, but the wife does, and they're on the exact same plan, which is always interesting because obviously each plan covers medications and certain things differently. So yeah, sometimes just seeing that, certain individuals, married couples, siblings, things like that. I've seen a lot of cases where they're on the exact same plan, even though they're in completely different states for their health, basically. One person's very healthy, the other person's not
Yeah.
as healthy, and they're on the same plan. And maybe that plan doesn't cover the medications in the best way. And, you know, unfortunately, because they are like, yeah, my husband's on this plan or my wife's on this plan, they're a little more hesitant to switch because, they've been on that plan with their significant other or their sibling, somebody they're comfortable with. So it is, another reason that
Yeah.
maybe a little fear comes in there. But I do think it's important, again, to do that annual checkup and to just be interested in it. I think it's important to know what it covers for you, know what doctors you can see, who you can't, and just be fully aware. 'Cause you don't want to go into the hospital, not know what your inpatient cost was for like an overnight hospital stay,
Mm-hmm.
and then, rack up $1,000 hospital bill because you were on a plan that you shouldn't be on, things like
Yeah.
that.
Especially um if you're hospital prone, I'll say it. Like
Hmm.
if you have a history, and a lot of times another mistake a lot of people make is I've seen it a lot. If you're hospital prone, say it lightly again. Like if you have a history or your family's had a history of going to the hospital, there's actually insurance on top. There's additional insurance that you can have to help you cover your hospital stays. They can help you help you cover cost your ambulance bills, surgeries, and things of that sort. And a lot of times these insurance, if you're below a certain age, I believe it's 74, 72, I believe is the
I believe
max
it is
age.
72.
Yeah. If you're, below 72, they don't even do a health screening for you to get this. So,
Mm,
and a lot of referrals, people bringing in, and people for us to help them, their friends and family, a lot of them come from this type of coverage
mhm.
because they go to the hospital and then after they get out, they get reimbursed for those costs. And it's just additional protection, for you. So a lot of people just don't even know about it.
Yeah.
So I mean, that's something that can really help people out
Mhm.
for sure.
And that's another thing of just calling in, even if you're
Mhm.
just calling in to take a look at benefits, that's something that we could let you know is, hey, that, policy that Josh was talking about, yeah, it may have a, $20 or $30 monthly premium that you have to pay. But with that, one
Yeah.
hospital or one ambulance ride basically
Pays
pays for
for it for the
itself.
year.
Yeah.
Yeah.
So, I know a lot of people aren't interested in having that monthly premium, especially with the Part B premium going up this year and things like that. But it does save you. If you didn't have that policy and maybe you went to the hospital for 5 nights and now you have a $2,500 hospital bill, had you had that policy that say you pay $40 a month for, then it would completely reimburse you for that. So it
Yeah.
definitely saves you quite a lot when it comes to some of those hospital costs.
Save you an arm and a leg, and
Yeah.
unfortunately, it doesn't cover dentures. So yeah, for sure, for sure. So yeah, I think that's pretty much all that I've got right now. Do you have anything else?
I think that's pretty much it. Those are
Yeah.
some of the most common mistakes that I see when it comes to
Yeah, for
Medicare.
sure. Um, right here, I was gonna see what the next podcast was on, but I don't think we have that down yet. Feel free to join us in our next podcast. We're just going to be going over some in-depth topics when it comes to your healthcare for Medicare past 65. We're here to help you at the Medicare team. So if you need anything, like I said before in this podcast, in the description below, there should be a link to book an appointment with one of us. We're licensed agents in your state. We're looking to help you. If you need any help, want any advice, or just want to just see what's out there, just feel free to go down, click the link below, and we're here to help you out.
Yeah. Even if it's just a small thing of just, you just want to take a look at your current benefits, just kind of refresh yourself, please do call. I'm more than happy to help you and take a look. And maybe there is something out there that'll cover you better.
And we want to make sure that if you need some dentures, that you got some coverage.
They'll be
If you
covered.
want to get some dentures, make sure you call us so you don't end up like that one person.
Make sure you call and have the denture coverage before you have the procedure done.
Yeah, before you have the procedure. So yeah, for sure. Well, thank you for joining us today, and we hope to see you in our next episode.